Welcome back. Here with us on Urban Debate on Mirror Now. The pandemic that arrived 2 years ago has taken a toll. It caused immense grief, misery, deaths. It made the growth rate plummet. The feeling of economic well-being disappeared. Big and small units shut down. It has taken immense amount of policy tweaking and grit of Indian entrepreneurs to pull the economy out. But the pandemic has also caused deep and silent hurt. Its victims can't be identified easily. And one such set of victims are the girl students in the country. A recent parliamentary panel's report says that it had asked the Ministry of Education to underline the effect of COVID pandemic and the resultant scenario on the progress made in terms of enrolment and retention of girls in the schooling system, especially from among the socially and economically backward groups in schools. The information provided by Ministry of Education must make everyone sit up and take note. The ministry said the school closure in India has affected 320 million children enrolled from pre-primary to tertiary levels of education. It is estimated that out of these, about 158 million are female students. There is a growing concern that the pandemic will disproportionately affect adolescent girls. Post-pandemic, this can lead to a higher risk of girls permanently dropping out of school and reversing the gains made in recent years. One cannot ignore the fact that there is a gender dimension in digital access to learning, which also varies across location and household status. In families which possess a single smartphone, it is likely that sons will be given the preference to access online classes, followed by girls if time permits. In the case of girls from very poor families living in rural areas, they may not even have access to any key technology. In fact, the closure of schools and hostel facilities for girls and the uncertainty in their reopening may also pose serious challenges so far as girls' education is concerned. That there is urban-rural divide flagged by the ministry. It says, as regards the impact of pandemic on learning skills of students, especially rural children, there are gaps in access to internet. And this pandemic, viewers, has worsened the urban-rural divide. Urban populations found it easier to access digital infrastructure, and eventually, it is the girl students who have suffered. So tonight we debate the challenge and what possible solutions can remedy the threat faced by girl students. Dr. Shashi Panja, Ministry in charge, Department of Women and Child Development and Social Welfare, West Bengal, joining us on the broadcast this evening. Thank you very much, Dr. Shashi, for joining us here on Urban Debate. Your first reaction to the findings of this report?
Yes, definitely. It is disappointing. But there have been tremendous setbacks during this COVID crisis. So there have been issues of health and socioeconomic devastation. And we are all trying to cope up with this crisis. And we hope to come out from this crisis. During the program, of course, I will lay out certain practices that the West Bengal government has started, since I get an opportunity now to speak to Mirror Now. And through you to the audience who are listening in. Yes, of course, we did go through the findings of the 31-member Committee on Women Empowerment, and the issues that they have flagged is of deep concern of the dropouts and actually virtual dropouts. I mean, since there are closure of schools, it's virtually, I mean, you can find that these figures, those who could not access any kind of education during this time. So those virtual dropouts are there. And of course, as you mentioned rightly, the digital divide. And not only that, it is a gender-based digital divide, which again you mentioned. So it is, we hope that we can improve our mindsets in the society of the mindset. I mean, there is still a bit of discrimination between the education for a girl or a boy child. But of course, during the course of the program, there is a light at the end of the tunnel, and there have been certain good practices in West Bengal during this period of crisis, which I can say on behalf of the government, because I also handle ICDS department. And of course, I could also give you some information on what the education department has done and is also thinking further. And there have been findings and statistics and reports which also has lauded Bengal for the foundational literacy and numeracy index during this period. And it's not a study which was done by West Bengal, it was done by the Economic Advisory Council to the Honorable Prime Minister. So it is from that level that they found that Bengal was doing well in foundational literacy and numeracy index amongst the large states with a score of say 58.9. And amongst the smaller states, Kerala was also doing well. Vis-a-vis, Bengal has a very good infrastructure, which again also has been lauded in this study. But yes, there is more to do because there are concerns that if the girls...
Yes.
Okay, I can go on, but if you allow me, then I can go on.
Yes. No, you're making some very, very important points, Dr. Shashi. I'll come back to you again in just a bit. I have more guests, in fact, joining us on the panel this evening. Gurumurthy Kasinathan, Academician and Director, IT for Change, Karnataka. Dr. Neha Jagtiani, Principal, RD National College, Maharashtra. And Dr. Priti Ojha, Principal, Delhi International School, Delhi, NCR, also now joining us on the broadcast this evening. Good evening to all of you. Gurumurthy, let me ask your view on what Dr. Shashi was telling us and the findings of this report. And clearly, I want you to focus more on solutions. We know that there has been a significant impact on girl students, but what should now be done?
Actually, if you ask me for solutions, there is a very simple solution, and that is to keep schools open. I don't know if people on this panel and in this country are aware, India is among the worst offenders when it has come to keeping schools closed. Many countries in Europe actually kept their schools open even when the pandemic was at its severe worst. In India, and the general thing that UNICEF, UNESCO say, schools should be the last to close and the first to open. In India, it has been the other way around. We first close schools and open them last. No, I mean the gender divide, the digital divide, the class divide, the caste divide, all these divides are real. Recently, Income Equality Labs released a report. India is one of the most unequal countries in the world. The top 1% own 1/3 of the country's wealth. The bottom 50% own 6%. So what is the digital infrastructure we are talking about in cities? It doesn't exist. I stay in what is called the Silicon Valley of India, Bangalore. And in Bangalore, the internet connectivity is not good enough to do online teaching. You can have connectivity to send WhatsApp messages, but teaching is much more complex than that. There is heavy dropout of children. Girls have suffered severely. So solution is very simple. Do not close schools. And since the West Bengal minister is here, I would like to point out, West Bengal is among the worst in the country in terms of school closure. They're probably second worst, the worst being Jharkhand. And I don't know why schools are to be kept open, because not in the first wave, not in the second wave, certainly not in the third wave are we seeing children dying. But children are dying, children are getting married early, children are getting to the labor force. Their lives are being messed up because political leaders in this country, across the political spectrum, I won't blame only West Bengal for that, whether it's BJP or Congress or any of the regional parties, they've kept schools closed, which is completely wrong. So the easiest solution is keep schools open. Okay. Unless you find children dying in large numbers.
Easiest solution is open the schools.
Close them.
Yes,
Absolutely.
We know that,
Schools
in many states of the
open,
country, schools are still shut and they need to be opened immediately.
Absolutely.
Very interesting.
Absolutely.
Quick response, Dr. Shashi, then I'll go across to my other guests as well.
I just would like to ask, I didn't know that we were one of the worst performers. I don't know the data which is available. And further on, being a medical doctor myself, actually COVID and the crisis, or the health issues, or the pathology, or the etiology and everything, we have been learning. You see, it's been an experience learning. Nobody from the very first go knew that which age group would be safe and which age group would not be safe. You see, experience has taught us. And this is what the findings are. Otherwise, we would not have had so many committees at the central government level, even at the state government level, with experts. You have a high-level expert, because we knew nothing about it and we've been learning. So it was almost advised. If you have a lockdown, if you have a lockdown and there is no transport, how do you expect the child to get to school?
We really opened the lockdown and we kept schools closed in Karnataka.
Well,
today,
absolutely.
In Bangalore,
I think Yes, I think the concerns that both of you are raising are quite valid, but now probably, we can't really change what happened in the past, but now we have this report out, so maybe now we can take the correct steps, and that's why, sorry, I asked you specifically that, this report is out there, and very nicely, the standing committee system has allowed us to see the impact of the pandemic as well on girl students specifically. So here is the time to talk about solutions instead of pointing fingers, and, that's the reason why we have this very interesting panel as well today on the show. Dr. Neha, a lot of work was done in the past. For example, we had Right to Education program, and then we have Beti Bachao, Beti Padhao program that's also going on. A lot of efforts were made to, get the girl children to come to schools. But now, there is a crisis. What is your prescription?
Thank you very much. Actually, there are 3 steps that I take. As an educator, I feel very alarmed and very disturbed because school education is not merely lectures and classes. It's an entire holistic personality development with peer-to-peer interaction, cultural, sports, etc. The last 2 years, the students have lost out. In fact, preschool children haven't even seen what a school looks like. They've only seen a screen. So there are 3 things as far as the underprivileged are concerned, which we followed in our educational institution. Number 1 is there is a lot of elite people who have devices, whether it's phones, whether it's tabs. So we try and bridge the gap, and we try and see to it that they can donate these kind of devices to all the underprivileged, so each have the equal opportunity. The second thing is that create an awareness, because girls, so are boys, but girls are generally very sincere. And there has been a lot of statistics to show that academically they have always done very, very well. So we try and create an awareness with parents that they should take out the time to educate their girl child, because she is going to grow up, do well, and she could probably one day even support the family. So that's the second thing. And thirdly, in every problem lies an opportunity. So in fact, in these pandemic times where schools have been shut, it's a very good time to access the right up till the interiors to the poorest of the poorer with digitalization and digital education. So we could take education further and make sure that in whatever way possible, we try and tap our alumni, we try and tap the industry. So they take out 2 hours, 3 hours a day and educate even the entire illiterate who never had a chance for education. Our students are teaching underprivileged people, people in the rural areas through these entire digitization. So I think that's the way forward. We have, COVID has disconnected all of us externally, but technology has connected us internally. So we have to make best of the situation and see as far as possible. And I agree, as rightly said, education should be a very top priority to open up as soon as things become better.
Well, that's interesting what you're telling us. But Dr. Preeti, this urban-rural divide that has been highlighted by the parliamentary panel is something that really needs to be addressed, I believe, on priority. Because, urban populations clearly found it easier to adapt to digital style of learning, digital schooling specifically. But, for example, in the rural part of the country, when migrant laborers started going back to their villages, they also did not, send their children back to schools. I mean, many of them were employed in various Manrega schemes, etc. Because for them, survival became most important than actually considering education of their children. And that's where even the girl child has suffered.
I totally agree. And I'm very happy that I'm sharing this panel with such eminent guests who actually have found information around what schools are going through. And the statistics read by Dr. Shashi has also been enlightening to me. But this pandemic, as she said, had never told anybody the way it has come. Schools has suffered the most because the child is the one for which the whole family survives for. And when they see that the child might get affected because of the kind of cases in the wave 1 and the wave 2 came up, the parents were paranoid. And there was a huge fear factor in them to not lose the life of a child rather than, losing their own. and jobs had gone. They had no other way out to come out and make sure that the children can get educated. And digital divide had actually made a lot of impact on the children who couldn't have a mobile. And let me tell you that the ones who wanted to give priority to the girl child, even in the urban areas and the rural areas, have given. And the ones you think that might have given in urban, they haven't given. So there had been possibilities of various kinds that we could see. The most important thing which I found here, in a very general way, which I have spoken to children, and I found that my children have got to know about what exactly the lacuna, the urban school, the rural school children go through. They have found the kind of information scarcity those children had during this lockdown. And they realized the value of things in the house which are important for children to get connected. So I think that youth who was thinking that everywhere it was a beautiful cloud, now understand there is a lot of darkness also around, and they really have to work around it. I think this pandemic has taught each one of us, in any stakeholder, like teacher, the parent, the leader, and various other stakeholders around the school community and the education especially, that there is so much more that one has to do with keep going with this time. And technology has taken another way where we could somehow manage to get connected to children. Otherwise, things would have been absolutely cut off from children. And I think schools were the only one which were moving ahead during the pandemic throughout the year with the children. And so much of awareness was brought through the education system to the schools to let the parents and the community know that how to handle their emotional balance. They were also told how exactly to handle their physical health. They were also told on various aspects, the school played a very vital role. But unfortunately, the children who couldn't have that gadget and the ones who couldn't get that information must have gone through a tough time. And I'm sure a lot of child abuse emotionally, physically, and neglect has come into picture, which definitely has to be addressed. And I feel rightly spoken by one of the panelists, schools should not have been closed till now. The phases in which it had been closed, absolutely accepted. But now I think again today in the morning also we read it in the paper that schools will be opening in phases. And I'm also waiting eagerly for them to open, not only for the girl child, but all the children that we look forward for.
Right. Dr. Shashi, now this report flags need for some urgent measures, to prevent girls, especially from poor families in the rural part of the country, from dropping out of school, some who are still enrolled. Can you tell us a little bit about the kind of measures that can really be expected from your side, say, from a state like West Bengal? And how soon can we expect schools to be reopened now?
Absolutely. I could highlight certain practices of the West Bengal government, which we took vis-a-vis education should be continued. The idea was we locked down in March 2020. From May 2020, we started this home-based parenting module. Now, I am talking about these ICDS, that means the pre-primary level, the 3 to 6 year age group. So they were all at home. I'm not yet going to the primary and upper primary, but I'm just saying about the pre-primary. So what we were doing at that time was our Anganwadi workers and helpers were reaching out with rations to the doorstep. So at that time, while they reached out to the doorstep, we started this program. Now, in this program, what we were doing is we understood the digital divide, but we knew that there were parents who did have a smartphone. But there were many who didn't have a smartphone. Now, our district functionaries were all equipped with these smartphones. So we had these modules which would go every fortnight. These were educational modules which would go percolate down the line through these smartphones till the family. Now, if the family did not have a smartphone, the neighbor would have. And so there was a neighborhood concept. And even if the neighbor didn't have, our workers or helpers would reach with their smartphone. Now, this contained a module for which you did not need to be highly educated. It was merely switching on the phone and everything would roll out, the module in our language, Bengali or Hindi. So this was one thing. And we continued and we are still continuing with it. And I can just tell you that those where we could not reach out with, obviously they didn't have the phones, we have community radio here in West Bengal. one in one of the districts, South 24 Parganas, and another in Purulia. So there, wherever the phones were not there, we went through the community radio. And wherever even this was not there, we also approached cable TV, the usual cable TV, through which also some serials and TV and all that. But through that, these educational module reached. And even then, I'm not overinflating or anything. Even then, till now, we have been able to reach, we have, I would say, 30 lakh odd children of that age group, 30 lakh who attend ICDS schools. So we reached out to say about 75% till now. So I'm not even going to say, that we reached out to everybody. So this is how tough it was. But we did this, and it's a good practice. We got awarded even by Scotch Award and all that. Now, there's the other thing which the Education Department is doing. Again, it is doing for the 5 to 9 years. And in Bengali, it's called Padai Shikshalay, which will means Pada mein ek Shiksha ki ek bandobast. So that means that in the community, we are opening up these open air schools, neighborhood schools, and all the teachers, all the para teachers, or all the SSK teachers who are now at home or whatever, will be involved in teaching the students there. So it is Pada Shikshalay, which is almost it's launched, but rolling out from February. And these are practices which will continue. Even if after the schools open, these modules and everything will be again taken up there. And the third thing we did was, again, a Bengali word, which says Pada Lekha, which means Padhai Likhna, Likhna or Padna. So this is again for that pre-primary age group, 4 to 8 years. In this, we are mobilizing the community. So there are parents who can teach. There are, I just now the principal before me spoke about the elder children getting aware that, the haves and the have-nots. So these children who can study, the elder siblings will teach the youngest, not only in my family, but they will teach in the neighborhood. So this is where we mobilize the community. So this is one practice which we are doing. And I think, at least the pre-primary.
Well, those are some very interesting examples you've given to us. Those are some very interesting examples you've given to us, Dr. Shashi. Yes. Okay, very, very interesting. And it's good to hear that you're also reaching out to children of all age groups, really. But Mr. Guru Murthy, do you think maybe other states can also learn from the kind of examples that Dr. Shashi has given to us? And in your opinion, what more can be done to, reduce this gap between children in the rural parts of the country and the urban parts of the country, the divide that has come because of the pandemic?
I would like to say two things in response to your question. The first thing is, I am a member of the National Coalition on the Education Emergency. So we set up this National Coalition on the Education Emergency last July because we were very concerned that schools are being closed for a long period of time. And of course, the pandemic is I would say it's beyond human cause. We don't know what caused it. And certainly the political establishment or anybody in society can't be held responsible for it. But the decisions we have taken in response to the pandemic, including school closure. I'll just quickly talk about it because I think the person we have on the show here is from the medical profession. And even in Karnataka, the decision-making groups are filled with medical personnel. They are not filled with people who understand education. And keeping children out of school has a very devastating impact on them. And that's why the National Coalition has been saying resume and renew. So the schools are to be open first. I already made that point. Now, in response to the point of what can be done, we have analyzed states across the entire country. So the National Coalition, we have a web portal where we have a tracker of all states. And that's how I could immediately say that West Bengal is actually the second worst in terms of number of days of school closure. Other states are better. And I request and I hope that West Bengal will keep schools open completely because the number of cases of COVID affecting children severely, we know it's negligible or not even there. And children are suffering even more by staying at home, not only in terms of loss of education, but when you talk about girls, early girl marriages have skyrocketed across the country. Even in a state like even in a place like Mysore, which is developed, child marriages have gone up by some 20%. Girls are being put in household jobs. They are not going back to school. We are seeing a 20% dropout. So we are in a crisis. I would say the first point is, and this is my appeal to the political establishment and to everybody watching this show, the worst thing we can do when we face a crisis is to pretend that there is no crisis. The medical emergency may be over. The third wave may not be severe. The education emergency is going to be there for another 10 years. And we should stop pretending that we have done a lot of things over the last 2 years. We have done our best. So whatever West Bengal has done, I would like to urge The example of Tamil Nadu, I think Tamil Nadu is a stellar example in today in terms of what they have done. Unlike all other states in the country, they're the only state which has given a separate budgetary grant of several hundred crores to tackle COVID. They're creating a separate community force for supporting schools in making sure that children catch up. They're making sure that schools are open. So Ennam Elthum and Kalvi Thedi Idam, that Idam Thedi Kalvi, sorry, these are the programs that Tamil Nadu has launched, and I think these are good for the whole country. I am not from Tamil Nadu, I am from Bangalore, and I think different states have tried digital devices, and I earlier said in the program, 1% of the country, the top 1%, which includes all the people on the show, we are all a part of the top 1%. We own 1/3 of the country's wealth. The bottom 50% of the country's people own 6%. So what digital devices or what community, we run a community radio program during the pandemic. Children are not able to listen to even community radio programs because they lack the devices even for that. And education cannot happen in some simplistic measures like that. Not to take away from anything that the West Bengal minister has said, completely respect the efforts of all governments of this country. We're in a crisis. So what we need to do, we are in the budget time now, and we are appealing to all state governments. India was supposed to have 6% of GDP in education. We cut the education budget last year. The central government reduced the overall allocation to education, and we are at 3% of GDP. It's our fervent appeal to the governments that please make the education budget double of what it is. Give money to school for repairing the infrastructure, appoint teachers where there are vacancies, provide them teaching learning materials, provide community support to the schools. It's going to be 2 or 3 years before we catch up. Let's not have any illusions about that.
Okay, so two things you've highlighted. One, there is a need to immediately reopen the schools. That's the need of the hour. And second, in the upcoming budget, the focus should be on education sector specifically. Before I take the closing comments of my other guests, coming back to you, okay, it needs to be doubled. Okay, the allocation should be doubled. Quick question, Dr. Shashi. Now, I asked you earlier, when can we expect now West Bengal government to reopen schools? So, is there any thought, or you're like still waiting for the numbers to stabilize, the COVID numbers?
No, numbers have stabilized out here. It has, and but for the third wave, so we have to be cautious again. And as soon as possible, for which preparations are already underway. You know, there's also the cleaning of everything was almost done. I mean, but for this third wave which came in. And regarding budgetary allocations, I think during COVID and for COVID, to handle the emergencies, West Bengal has not received anything from the central government, and we had to do it all on our own. And I know there was double tragedy out here because we had even the cyclone, the Amphan and all the Tufans we had, one after the other, yes, but it was never declared as a national disaster or anything. Then we would have got extra money or sanctions. So despite that, I think West Bengal has fought it on its own. I mean, it's not at all a political issue, but unfortunately, the thunderstorm and the cyclones which took place, there was a lot of damage. Even the schools and the infrastructure has been repaired. So there have been allocations. I mean, there are allocations. Maybe we don't speak so high and mighty, but yes, we have had separate allocations so that we could tide over this COVID crisis vis-a-vis the education center and the ICDS.
So that's why, ma'am, we have you on the show today to understand, you know, the challenges on your part as well, because this parliamentary panel hasn't really, you know, spoken about any one particular state. It's about the women, the girl child specifically across the country and how they've been hit very badly in the pandemic. Dr. Priti Ojha, your closing comments, one thing that you will like to suggest to the governments across the country.
Whether pandemic or not pandemic, I want education to be given to children, not girl or a boy, because this is where we start the division. The SDG goals, equality, where schools are making sure that both the genders are equal, has to come from the family. How much ever 6 hours, 7 hours, 10 hours schools keep working, it has to be a community orientation in the family, which has to be breaking down the conditioning of the mindset of parents of dividing the girl as a minority and boy as the better gender. That gender divide has to be broken, which we schools are working very hard. We are making sure that the parents in the orientation get to know the strengths and weaknesses of both the genders and let them know that how exactly can they uplift the motivational thought of the child, whether a girl or a boy, that you both are important for the citizenship of our country and you both have to take it forward. And this is how we have been struggling during this pandemic. And absolutely right, as one of the gentlemen said, that learning gap has definitely come and we teachers are going to really struggle with a lot of things: reading, writing, speaking, socio-emotional thoughts which a child would have generally got in between, during the school, which is lacking totally. So the children come outside the gate of the school and they just keep looking at the school and say, that's this place where I had to study. That kind of a scarcity shouldn't have been there. Unfortunately it was, but now we are looking forward for schools to open and sure we all go together with children of both the genders.
Okay, but Dr. Neha, one cannot really ignore the fact that there is a gender dimension to digital access to learning as well, which varies, from one city to the other, from one location to the other in the country.
Well, I'll just say that teachers as a community have worked hardest. Just from chalk and talk, they have gone into login and talk. And next day of the lockdown, they have continued educating students as much as they can. They've learned newer methods of interactive classes, engaging them, giving them activities, doing their best in the situation to make sure that the students don't suffer. I think my personal opinion is that computers was going to make the big change, but I think mobile phones have already done that. If you look at the lowest strata of society, right from our gardeners to our watchmen to our vegetable vendors, everybody today is very, very well versed with the mobile phones. Technology has really taken everybody by storm and they are totally aware of all the apps. So it has become much, much easier for them to actually, for the students to access through their devices all the education. Having said that, I repeat what I said before, nothing like the entire school environment. So I think the government really needs to take cognizance of the fact that schools and colleges provide an entire holistic development. So as soon as possible with COVID protocols, need to.
All right. I appreciate all of you. Thank you very much for joining us here on Urban Debate this evening. And thank you for giving us those interesting suggestions as well. We can really hope that these are implemented by the governments across the country because it is about the children, the future of our country. Heading into a very, very short break right now. There's lots lined up for you on the other side as well. Stay with us.